What if dizziness, brain fog, and vision problems aren't separate issues, but connected symptoms of a rare disease? What if persistent headaches aren't migraines, but something most doctors have never encountered? These are the questions that often go unasked when someone begins experiencing the unusual mix of symptoms later diagnosed as Susac Syndrome. Many patients are told their symptoms are all in their head until an MRI reveals the truth. Their immune system is attacking the small blood vessels in their brain. For anyone dealing with unexplained neurological symptoms, or who knows someone who is, the following information might provide the clarity they've been searching for. Imagine a body speaking a language doctors can't understand. That's what happens with Susac Syndrome, where seemingly unrelated symptoms create a puzzle most physicians have never seen. The journey often begins with unexplained headaches, not ordinary ones, but persistent, medication-resistant headaches that feel different. Patients sense something unusual, but struggle to explain it to doctors looking for familiar patterns. For one patient, Teresa, it started with strange vision problems, described as cotton wool spots. Months later, vertigo and tinnitus appeared. I heard a loud pitch in my ears out of nowhere, she recalls. Then came dizziness. It felt like I was falling to the left, like I was on a boat. These symptoms don't all show up at once. They appear gradually, sometimes weeks or months apart, making it hard for patients and doctors to connect the dots. Each specialist focuses on their area, the ophthalmologist on vision, the ENT on hearing and balance, and the neurologist on headaches and brain fog. Most patients see 7 to 10 specialists before getting the right diagnosis. Each doctor runs their own tests, missing the bigger picture. Modern medicine's focus on specialization creates blind spots for rare, multi-system conditions like Susac Syndrome. The emotional toll is heavy. Patients feel isolated, questioning their sanity when tests come back normal despite debilitating symptoms. We didn't know where the vertigo was coming from, Teresa says. The ringing in my ears was unbearable. The gap between what patients feel and what tests show creates a unique kind of suffering, one where they must fight to prove their symptoms are real. The tinnitus feels like a screaming in my ears, making the head a crazy place, while the vertigo makes it feel like falling sideways on a boat. These aren't minor issues. They disrupt daily life. Imagine trying to hold a conversation while feeling like you're falling or working while a high-pitched noise fills your ears. The unpredictable symptoms make normal life nearly impossible. Even family gatherings become overwhelming when the brain can't filter sounds, balance is off, and vision plays tricks. Many patients withdraw socially, finding it easier to stay home than explain their invisible struggles. Doctors, frustrated by unclear test results, often blame stress or anxiety. "It's just stress," becomes a phrase Susac patients dread. This misdiagnosis adds emotional pain to physical suffering, making patients doubt themselves and delay seeking help. Ironically, part of the problem is in the head, but not in the way doctors mean. Why do doctors mistake Susac syndrome for stress or anxiety? Because it's incredibly rare, affecting only 1 to 2 people per million. Most doctors will never see a case in their careers. Its symptoms also mimic more common conditions like migraines, multiple sclerosis, or psychiatric disorders, creating a maze of misdiagnoses. The journey often reaches a breaking point when the body sends a message that can't be ignored. What happens when someone suddenly loses part of their vision, as if someone painted over it with white paint? This dramatic moment often reveals the hidden pattern behind the symptoms. For Teresa, the vision loss was unmistakable. "It was like someone took white paint to the top right part of my sight," she said. This marked the turning point where her scattered symptoms finally pointed to one rare condition. Susac syndrome doesn't follow a predictable path. Symptoms can appear randomly across different systems, confusing patients and doctors alike. It targets 3 key areas: the brain, retina, and inner ear. The immune system attacks small blood vessels in these areas, causing inflammation and reduced blood flow. The diagnosis often comes when a doctor recognizes the classic triad, brain fog or headaches, hearing problems, and vision issues occurring together. This pattern is unique, but requires a doctor who knows what to look for. MRI scans play a crucial role. They show specific lesions in the corpus callosum, the bridge between the brain's hemispheres, that look like snowballs or spokes. These help distinguish Susac Syndrome from conditions like multiple sclerosis. Without this tool, many patients would remain undiagnosed. Getting a diagnosis brings mixed emotions. There's fear about facing a serious autoimmune condition, but also relief in knowing the symptoms aren't imaginary. For many, it's a chance to trust their bodies again after years of being dismissed. Understanding the disease helps. When blood vessels become inflamed, they restrict blood flow to vital tissues. Without enough oxygen and nutrients, these tissues malfunction or die, causing symptoms across multiple systems. Headaches and brain fog come from affected brain vessels, hearing issues from inner ear damage, and vision problems from blocked retinal vessels. The severity varies widely. Some patients have mild, manageable symptoms, while others face severe hearing or vision loss. This variability makes treatment challenging, requiring a personalized approach. While a rare diagnosis can feel isolating, it also connects patients to a community. Online support groups and rare disease organizations offer resources and shared experiences. Though small, these communities provide valuable guidance. Susac Syndrome is just one of nearly 7,000 rare diseases affecting millions of people. Behind each diagnosis is a struggle, not just against the disease, but against a healthcare system built for common illnesses. Early diagnosis can make a huge difference. Research shows that treatments for rare diseases often provide significant benefits compared to those for common conditions. For those navigating unexplained symptoms, persistence is key. Every person with a rare disease who finds answers does so because they refuse to give up. They're not alone. Finding a doctor who recognizes the pattern in their symptoms can turn years of uncertainty into a clear path forward, not just for treatment, but for reclaiming their life.